Hi guys, Dr. Sinicropi here, and I wanted to talk to you about something today which I like to coin starting bias in healthcare. And what that means is, depending on the entry pathway that patients take into the system, that entry pathway often will absolutely determine the course of action that will be taken for that particular condition and put them down a certain road that is going to be quite specific to the type of practitioner that they are seeing, since there is so much non-standardization in what we do in healthcare. So for example, if you present with sciatica or pain down the leg, for example, you may start with a neurologist, a chiropractor, a spinal clinic, pain management clinic. You may start with a holistic practitioner, your primary care doctor, or others. They will then set the course and the pathway for your treatment strategy, and might be radically different depending on who you see. Now, the reason this is important is that patients absolutely want to be the masters and CEOs of their own healthcare. And so it's very important to understand how these sequences are set in motion and where and what types of treatment you'll actually end up getting, and if that is something that you really feel is absolutely best for your own particular health. Now, there are two things that patients can do to really be the CEOs of their healthcare, to try to understand that there is this starting bias that occurs. And those are these. Number one, strongly recommend doing your own research and really coming armed with an understanding of your condition and what the vast amount of options may be. Now, I caution, Dr. Google is sometimes quite confusing, and you really need to find non-biased, scientifically based resources that can help you with this, and we'll discuss this in a later video. The second thing that people need to consider doing is, if they get a treatment recommendation for a particular condition, consider going to outside specialties. In other words, people that view these conditions in very, very different ways, in order to try to understand what your treatment options are and what may be available for your care. So in summary, do your own research and consider outside specialties to look at different options for your healthcare and treatment. I hope this helped. We'll see you in later videos. Have a wonderful day.